have the team member here. And this is our strongest team. So we have some kind of diversity, very young and beautiful ladies, and all of them are smiling. It is very important for us to make a good success story. And then we invite Professor Bayer lives in Omron. So he is shaking hand with the previous president of Omron. And then I would like to introduce a very important person, Mr. Tatsuro Ichihara, next to Byron. He decided to join a strategic partner of mediaX. His decision is very, very powerful. And they are now chatting and drinking like this. You can guess their wonderful personality and humanity. I love them. And this is the Socially Intelligent Agent Team Mark II, 2008. So anyway, I will come into a main topic here. Firstly, I will introduce about that our background and the motivation. So as you may know, we Japan had a super aging society now. From 2007, so over 20% of our aged population. It means that over a 65 years old person. And the shape is very drastically changed. So in the middle of this century, the population aging rate will be 40%. Very, very drastically changed in Japan. But not only Japan. Almost all developed nations will be into aging, super aging society. But Japan is the forefront nation. But the problem is that Japan declined the number of the population, but the number of the patient will be the same or increase. For example, hypertension here is almost all 40 million. And diabetes increase 30 million. It is a very serious problem. And that the problem here is that so this kind of lifestyle disease is that a main cause of long-term care need. Almost all 20 to 40% of long-term care need cause. Mainly cardiovascular disease, like heart attacks and brain stroke, something like that. So that's why we are very focusing on improve that lifestyle disease. Needless to say, lifestyle habit is the cause. Overeating, and too much drinking, smoking, lack of activity, something like that. So this is a very serious fact, evidence from epidemiologic study. So these are 4 risk factors: obesity, hypertension, high blood glucose, and high cholesterol. If you have just 2 from them, the cardiac disease risk is 10 times higher than 0 risk. If you have 3 to 4, the risk is 30 times higher. Very serious problem. That's why, as I mentioned before, the lifestyle disease and metabolic syndrome is well known in Japan. It's a very serious problem. So now, consider about the measurement in daily life. So, as I said, the lifestyle disease should be treated by lifestyle habit change, right? Of course, you can use some medicine, but basically, lifestyle improvement is very, very important. So that's why. So this chart is the relationship between a medical field and home. I use that word of home very widely meaning. In the life in home, at the work at the office, and some kind of hobby or something. But anyway, 5 minutes, 3 minutes, 10 minutes in hospital or clinic, very short term. Almost all of your life is at home. So, the data measurement at home side is very, very important. This is a very simple example. This is a blood pressure variability. It brings very important and great deal of information of your health condition, right? For example, we had know about that kinds of hypertensions like this. Early morning hypertension, during night hypertension, and the white coat hypertension. In front of a very beautiful nurse or a handsome doctor, I don't know, that your blood pressure will be changed. On the opposite side, masked hypertension. So you can see that these kind of hypertension cannot be diagnosed at the medical field. That's why Japanese Society of Hypertension employs a home blood pressure, so measurement in home. It employs that this blood pressure as a criteria of that hypertension is a red one. So systems approach. So as I mentioned before, so lifestyle improvement is very important. That's why we should measure something happened in our lifestyle. So what is a lifestyle? So firstly, diet and nutrition, meal, something, and exercise, the rest and sleep. Three very main things in our lifestyle. This is the basic idea of a systems healthcare by using a sensor to measure your lifestyle and vital signal like blood pressure. So all of you know this relationship. If you have good exercise, it has a good influence to the weight loss. Weight loss brings that blood pressure stability, and also good exercise will bring you good sleep. And good sleep will have a good association with that blood pressure stability. But I would like to emphasize here that this kind of data is just used for you. So personalization is very, very important. We have a lot of evidence from epidemiological study, but it is basically average one. It will be suitable for you, but not suitable for you.